Steroid or not, asthma medications and their effects. Presented to you by Oscar Hernandez. The problem with asthma medications nowadays is that medications contain steroids and corticosteroids that are 1. Expensive, 2. Have multiple side effects, and lastly, they may be quite difficult to use because some require extraneous machinery such as aerosol machines and inhalers. The solution to this steroid problem is Dupilumab and goes by the brand name Dupixent. Dupixent is doctor prescribed and is dosed only once every month. The medication is inexpensive, with multiple insurance companies covering the cost of the medication. Dupixent is better than other asthmatic medications because it is non-steroidal. Dupixent has been proven to positively affect the asthmatic person's airway. Easy for everyone. The use of Dupixent is quite simple. It is simply injected at home. If the patient were to have a hard time, there is a Dupixent hotline available 24/7, as well as an informative video to inject Dupixent. Although some may have a hard time, it is a once-a-month dosage. The process is straightforward and quite easy. Dupixent injection. As displayed, this is the simple injection syringe that is used for Dupixent. Here we have a video that shows the Dupixent injection process. The opposing view. Dupixent can be difficult for some. The ineffective use of needles is argued by many. There's also the fear of improper injection and the disposal of needles that brings to question biomedical hazard waste. Inexpensive for everyone. Dupixent offers My Way copay card. This card allows for patients to use the medication free of cost and will spread out payments for the people that do not have insurance to cover it. It's a brand name prescription that is covered by a wide array of insurance companies. Dupixent costs around $3,300 and is only taken once a month. In comparison to Dupixent, steroidal asthma medications are in fact cheaper, but the dosage is sometimes even daily. In other words, the medication has to be purchased at a higher amount. The opposing view. Dupixent might be expensive for some. Although Dupixent does try to make their medication available for all who need it, there is always a slight possibility that the insurance will not be able to cover the expenses, and Dupixent will become an out-of-pocket expense for the patients. Dupixent has been proven to better the airways. Dupixent, as previously mentioned, does not contain steroids, which is quite beneficial for asthmatic men. Male reproductive organs, such as the testes, are negatively impacted by steroidal medication. Also, the case studies and clinical trials have proven Dupixent being a long-term problem solver in comparison to steroidal medications that have negative effects and are short-term solutions for asthma. The process for injecting Dupixent is quick and simple and does not require extraneous machinery or assistance in any way to inject. The opposing view on how Dupixent does not better the airway. There will be people that are impatient and will argue that steroidal medication works faster than non-steroidal. Steroidal studies are quick, but in the long term, benefits are not detectable. Steroidal asthma medications have multiple ways of being ingested, such as aerosol machines, inhalers, and powder discs. This chart supports the opposing view on how Dupixent is unfavorable to asthmatics. Demographics and baseline characteristics of asthma trials. The majority of the trials were done on white women who have had asthma for, at an average, 20 years or more. In conclusion, Dupixent is inexpensive, more effective, non-steroidal, and only will need one dose every month. The call of action for Dupixent. Dupixent should start working alongside more doctors to effectively target asthma. With this, they'll have a better word-of-mouth advertisement and will begin to be more widely available for patients. The solution for Dupixent? If done effectively, Dupixent will clear the airway more effectively without using steroids, while only having to take one dose every month, free of charge when the insurance covers all the expenses. Here's reference page 1 and reference page 2. Thank you.